We continue with another dignified speaker, Mr. Matthew Smith, who is the founder and executive director of Fortify Rights. Recently worked with the Human Rights Watch, where he authored several reports on critical rights issues in Southeast Asia. Previously, Matthew served as a project coordinator and senior consultant at Earthrights International. His work has exposed wartime abuses and forced displacement, crimes against humanity, ethnic cleansing, multi-billion-dollar corruption, development-induced abuses, and other human rights violations. He's written for the New York Times, the Wall Street Journal, CNN, and other outlets, and Matthew has worked with Kerry Kennedy on the Robert F. Kennedy Center for Justice and Human Rights on Speak Truth to Power, has experience as a community organizer in New York City and emergency services caseworker in Mobile, Alabama. He has an MA from Columbia University and a BA from Lemoyne College. Please welcome Mr. Matthew Smith.
Thanks so much. Thanks very much to the organizers for the invitation to be here today. I flew in from Thailand yesterday, and I'll have to apologize. I'm a bit jet lagged right now, but I've realized I've discovered a cure for jet lag, and that is sitting front row when Tom Andrews is giving a very amazing and incredible speech. Fortify Rights, I'll just say a quick note. We're a new organization, and we have a two-pronged mandate. So we are conducting independent human rights monitoring and advocacy, which involves documenting human rights violations, conducting strategic advocacy, some of the work that's been discussed here today. But we also provide technical support to human rights defenders, and that side of the work was in line with some other things that have been discussed today. And that support has taken the form of trainings and workshops and other types of technical support to human rights defenders that are, like many of you, that are dealing with situations of abuse. There's a great deal to discuss, of course, and I'll also try to keep it very brief. I'm told there are thousands of people watching right now and tuning in online, which is fantastic, and it's a testament to the usefulness of technology for this type of work. So with that in mind, I'm going to take the opportunity to say a few words about the crime of genocide generally. I'm not an expert on international criminal law or the crime of genocide for that matter, but there are a couple issues that I'd like to speak briefly about. I'll touch on a new report that we released in February on some of the restrictions that are in place against Rohingya. And then lastly, I'll just share a little bit about the current situation in Rakhine State. I'm afraid that Dr. Stanton and Tom are very, very difficult acts to follow, so I hope I don't put you to sleep here today. But the Genocide Convention, for those of you that have looked at it, and I think many of you have, it's not a particularly detailed law, but it's not any more vague than other international human rights conventions and laws. The content, because the content of the convention has generated some confusion that I've noted in our advocacy work and also too in just observing the discourse around this issue. We've noted significant confusion on the scale of killings that's necessary to constitute the crime of genocide. So when the general public thinks about genocide, they think about Rwanda, they think about the Khmer Rouge, the Holocaust, and so on. And thankfully, we haven't seen that scale of murder yet in Rakhine State. This, however, is part of the reason why I think people are very hesitant to invoke genocide. And there are others who have some sensible reasons why it might be strategic to use this word very carefully, of course. But the scale of murder is not a reason to not use the word genocide. It's not a reason to back away from this term. The convention actually doesn't specify the number of killings that have to take place for abuses to constitute acts of genocide. The reason for that is very simple. when designing and joining the convention, states didn't want to have to wait until a population was entirely obliterated before they could act on it. So in other words, the intention of the convention was first and foremost to prevent genocide. And to prevent genocide, states and all of us and people, they need to be able to recognize it before it's been completed. Another area that's drawn criticism over the years has involved the stipulation that perpetrators of genocide could attempt to destroy a group not only by killing its members, but also by other means. This has generated a bit of confusion in some circles. Now, under the latest evolution of genocide under the Rome Statute, there are 5 criminal acts that constitute the crime of genocide, and as Dr. Stanton said, the prevention of births alone could suffice when making a determination about genocide. Just very briefly, these 5 criminal acts are causing serious bodily or mental harm, deliberately inflicting damaging conditions of life, and in the cases of Rakhine State, that could involve denying humanitarian aid, as Tom and others have spoken about so eloquently. Preventing births, which has been a very transparent policy in Rakhine State for many, many years. Forcibly removing children. These are all acts that would fall under proscribed conduct under the Genocide Convention. There's another aspect that I think is worth discussing, and that is the fact that the crime of genocide is a crime of intent. Proving intent to destroy a population of people is often talked about as not being very easy to do. Specialists, including Samantha Power, who, of course, wrote a book that I'm sure many of you have read about America in the age of genocide, and now she sits in the driver's seat, in a way, as the U.S. ambassador to the United Nations. Samantha Power and others have rightly pointed out that people who are committing genocide rarely put their plans down in a tangible way. So it would be unusual to find recordings or documents outlining the plan to destroy a population. These days, the focus with respect to the Genocide Convention is less about a plan and it's more about a pattern, and that is actually written into much of what's discussed when considering the Genocide Convention. But still, the easiest way to prove intent to commit genocide would still be to show how the group had already been destroyed. And obviously that's not good enough. And I think the more and more that these debates take place, as was discussed, people are dying. These policies are continuing. And so I think events such as today really strike home as it strikes to the core of this desire to prevent something from getting much, much worse, and those risks are there. So in terms of the evidence that we've collected, the central government of Burma, or Myanmar if you prefer, categorically denies that state security forces have been involved in any abuses against Rohingya. Full stop, absolute denial. Naypyidaw also disavows responsibility for humanitarian deprivations that are occurring. And this is where we see the authorities trying to persuade the international community that humanitarian deprivations either don't exist or they're the product of rogue state-level officials or citizens of Rakhine State. In other words, it's the good office, back office dynamic that they're trying to discuss with the international community. The official state line is that problems in Rakhine State from 2012 to today stem from intercommunal violence. As we've heard here today, there's a mounting body of evidence, very credible evidence, I would argue, that points to the contrary. State security forces have committed killings. They've stood by and watched as civilians were being killed. They've effectively participated in forced population transfer, which is a crime against humanity under international law. Rohingya intellectuals and other civilians have been arrested and imprisoned on trumped-up charges. Many of them are still in prison today. And beyond that, what we're documenting now is the authorities are actually hunting down other Rohingya in Rakhine State, as many of you I'm sure are aware. The authorities have obstructed life-saving aid. They've denied freedom of movement, not just of citizens, but also of displaced populations. And they're openly attempting to prevent births. And as I mentioned, they have been for a very long time. These are abuses that are right out of the genocide playbook. We can't be so timid as to not recognize that. But also, I would argue we can't, and thankfully no one seems to be these days, but we can't be loose with language or allegations, or it can cause some problems with respect to achieving the objectives that everybody shares here today. But I don't think that's actually a problem, and not particularly at this point while the situation is worsening as it is. So from our perspective, it's very safe and profoundly unfortunate to say that state and non-state actors are deliberately inflicting conditions of life designed to either drive Rohingya out of the state or designed to destroy the Rohingya. As far as I'm concerned, there's very little debate about that now. On a more systemic level, we released this report called Policies of Persecution. We released that on February 25th. That report exposes some of these abusive restrictions that have been in place for many, many years as a matter of state policy. These policies are all still in effect, and in some places they're being tightened. We've noted that in the last few months in northern Rakhine State. The government has still not provided a credible response to the report. About 1 hour after we released it, Ye Tut, the president's spokesman, referred to Fortify Rights as a quote-unquote Bengali lobby group. And we were joking that we released a report documenting severe abuses taking place in Kachin State, and we were expecting him to now start to refer to us as a Bengali and Kachin lobby group, but he hasn't done that. But the report that we released, it's based largely on 12 leaked government documents that came into our possession. These documents comprise 3 regional orders and 5 addenda to those regional orders. They date from 1993 to 2008. They basically outline the architecture of abuse that had been known for many, many years. The restrictions that we've documented or that are contained within these documents and other research that we were able to do infringe upon the rights to non-discrimination, to nationality, movement, marriage, family, health, and privacy. I think it's worth mentioning that the documents that we obtained there's no reason to think that the research that we conducted was exhaustive. I think there's very good reason to believe, actually, that there's far more documentation out there which has a certain evidentiary value in seeking justice in these cases. Like many of the laws in Burma, the restrictions that we obtain predate the current government. Some have argued that this renders them irrelevant, but most of the laws in the country actually still predate the current government. And it's important to note also that all of the laws are still enforced. So these restrictions are still in place. Just to briefly touch on a couple, we obtained, with regard to the two-child policy, we obtained and published a Rakhine state-level order from 2005 that criminalizes Rohingya childbirth outside of wedlock and applies restrictions on the right to determine the size and spacing of one's family. This has led to a number of other human rights violations. Rohingya who've been fearful of harsh punishments for violating the order for many, many years have instead opted to flee the country. Some women have undergone unsafe and illegal abortions, resulting in very severe health impacts. We've noted that abortion rates, we obtained information that indicates abortion rates in northern Rakhine State are actually far higher than in other parts of the country. At the intermission, you may have seen the film by Nicholas Kristof in the New York Times. in that film, I'm not sure if this bit was played, but he questions the Rakhine State spokesman Win Myint during the course of the film, and he questions him about maternal mortality and the fact that Rohingya women are dying during childbirth because MSF and others have been unable or evicted from the state. And his response was quite chilling. His response to, when faced with those facts and that question, was to talk about how there's a need to curb births. So this is again one of the more striking elements of what's happening to the Rohingyas, the very transparency of it all. It's right there in front of all of us. It's on the New York Times. It's on film. On the issue of marriage restrictions, official orders from 1993 to 2009 outline a very consistent state policy of restrictions on marriage imposed against Rohingya and Rakhine State. Rohingya couples, and particularly in the case of our report, we documented in northern Rakhine State, but it would carry to other townships throughout the state. They can't live together unless they're married, and as a matter of policy, Rohingya couples there can't marry freely, and getting permission to marry can be very difficult to obtain. The film that we saw at the very beginning of this event by Al Jazeera interviewed a few people who were speaking to that phenomenon, those abuses. With respect to freedom of movement, we've documented policies restricting freedom of movement. Rohingya movement between village tracts, between townships, and beyond is restricted. This is still the case today. Restrictions basically create conditions of life that make livelihoods, access to health care, other aspects of daily life very difficult. And this also has had a very destructive impact on the Rohingya population, but it's also driven people to flee the country. It's worth mentioning here, restrictions on movement, as many of you know very well, are also imposed on the displaced population in Rakhine State. And this is where internally displaced person camps start to enter into the territory of concentration camps. And I don't think that there's any problem with using those words to describe the camps that are in Rakhine State. These restrictions on movement, coupled with the avoidable deprivations of humanitarian aid, have had a very destructive impact on the population there, a deadly impact, in fact. These abuses, as I mentioned, they've been documented for many, many years. As far as we know, this was the first time that the policies had been actually given a broader audience. There were other parties who did have some of the policies prior to our publication, but a number of calculations went through our minds before publication. But first and foremost, the reason why we went forward with it was because these policies deserved a broader audience and because these abuses have to stop. With regard to the situation on the ground, I'll just say a few words about that. Prior to working with Fortify Rights, I was working with Human Rights Watch, and back in 2012, I was in Rakhine State when much of the violence was happening. Initially, I should say we did document violence committed by both parties, so there were killings being committed by both Rohingya and Rakhine early on. It didn't take long for a shift to take place, and when that shift took place, state security forces and Rakhine civilians teamed up and orchestrated attacks on Rohingya villages and other Rohingya neighborhoods. So then some time passed between June and October, and during that period of time there was a great deal of community organizing taking place. Monks associations, civilian associations, communities were getting together and discussing how they can deal with what they refer to as the Rohingya problem. And during that time, we documented how some government officials were involved in those meetings, in those town hall style meetings. In fact, the largest town hall style meeting to date, and the Rakhine cited as one of the largest town hall meetings that they've ever had, was in Retudong Township about this particular issue. And it is, of course, very sad that this is the reason people are organizing right now in Rakhine State. So during this period of time, the writing was on the wall. There was quite a lot of information that was shared actually with the central government. Pamphlets were appearing. Letters were being sent to government officials in Naypyidaw. People knew that a very significant event was about to happen, and then of course it did. In October 2012, violence struck again, and I was also there when some of that was taking place. And as many of you know, the violence hasn't ceased. And I think this is one of the big misunderstandings, that there were just these two major events of violence. But we're documenting, continuing to receive reports of violence consistently taking place. In fact, just a couple days ago, Rohingya blogger and some others had publicized the fact that there was a risk of more attacks taking place. So I'll finish in saying a few words about the humanitarian situation and what I think we can very fairly refer to as avoidable humanitarian deprivations. They don't have to be happening. In the camps today, very conservative estimates suggest 140,000 people are displaced. There are tens of thousands of others who are displaced. And there's a large segment of the displaced population who are unregistered. So even there, it's the authorities are not recognizing the displaced status of some of the people who are attempting to receive some humanitarian provisions. The most urgent needs are medical care, water and sanitation, shelter. As we saw and heard earlier, there were attacks against INGO and UN operations in Sittwe. That was about 3 months ago in late March. It should be mentioned that this was further to months and months of threats and intimidation that aid agencies were receiving. And the authorities never properly addressed it and still are not properly addressing that. It's taking new forms, and there are new obstructions coming into play in affecting the way that aid agencies can deliver humanitarian aid. Some aid workers now have returned to Rakhine State. Some have resumed work. MSF is still not allowed back. Maltesers still not allowed back in Rakhine State. So there are still major gaps in the humanitarian response. And I would argue this is due directly to decisions made by the central and state governments. But beyond that, the Rakhine-led coordinating committee that is now overseeing the monitoring of humanitarian aid in the state is also being obstructive in a number of ways. The government's denials haven't ceased. We've seen recently government officials claiming that Rohingya families are rejecting humanitarian aid because they want their children to get sick, because they want to be able to show sick children to journalists. This is coming from state officials. They've actually said this in the media. And I think this reality is part of the very inconvenient narrative that certainly people in Washington, D.C. and in other capitals around the world don't want to hear that reality. In terms of the delivery of aid in the state, it appears as though the objective of some Rakhine in the state is to achieve a voluntary withdrawal of humanitarian groups. So basically what they're trying to do is to make the delivery of humanitarian aid so difficult for the groups that are there, for the groups that are willing to see past the threats and intimidation. They want to make that job so difficult that the groups will just give up and leave the Rohingya without aid. In some ways, humanitarian organizations are required now to abandon the humanitarian principles, which would dictate that they provide aid to the most in need. Groups are being pressured to provide aid evenly to Rakhine Buddhists and Rohingya Muslims, and this is also creating problems as well. There's a bit of a misunderstanding about emergency humanitarian relief and development. Because of course Rakhine State is one of the poorest places in Burma. The Rakhine population also has suffered many abuses over the years, and this creates a very difficult landscape indeed. Operational restrictions on aid groups are making it very difficult, as I mentioned. And this takes a lot of different forms. In some cases it's subtle, in some cases it's quite direct. There are obstructions to actual access to some areas, like some camps simply are not accessible to all of the groups that need to be there. In other ways, they're making it very difficult for aid groups to find office space. They're making it very difficult for aid groups to set up their shop in Rakhine State. So I guess I'll just leave it there. I think I would really love to have, if there's still time for a discussion, I would really love to have a discussion about an action-oriented discussion, which I think is the real strength of events like this. And I think figuring out ways that the Rohingya will not be sacrificed at this altar of political reform, which is basically what we appear to be seeing today, to overcome this. So with that, I'll close, and I just want to thank you all very much, and thanks again to the organizers. Thank you.